Well, for most people, varicose veins have a genetic cause. And when you talk to patients, they'll tell you, yes, my mother or my father have varicose veins, other members of the family do. So that's the main cause. Some other things then will obviously add to the risk of forming varicose veins. So I see a lot of people who spend large amounts of time on their feet, generally people who work in retail, hairdressers, teachers, and the likes. That will bring them on. There are other causes that are more important for certain groups of patients. If you're at risk of varicose veins, then pregnancy will quite often drive the process or accelerate the process. And again, I'll see patients who've maybe had 2 or 3 pregnancies, and they're telling me each time after delivery, my veins got worse during the pregnancy, shrank a little bit, but they never went quite back to where they were. Those are probably the biggest factors that affect most of the people that I see. For most people, the veins don't cause a lot of symptoms, that they're really just a source of cosmetic concern. But for probably about 2/3 of people, when you actually dig down, you realize that they are experiencing some of the more common symptoms that occur. The type of things that people will describe to me are an aching and a heaviness in the legs themselves, or even a throbbing in varicose veins. And this is something that gets worse as the day goes on, and will be worse in days where they've been on their feet for great lengths of time. The problem with that group of patients is that those can be quite common symptoms that occur in everybody, even in patients who don't have varicose veins. So I have to spend a lot of time taking history carefully, assessing the veins, and most importantly, looking very carefully with an ultrasound before I advise the patients on how likely that group of non-specific symptoms are going to resolve after treatment. There are other symptoms that are very strongly associated with varicose veins. If you're getting itch in the lower part of the leg, particularly just above the ankle, then that's a sign that the varicose veins are starting to cause more significant problems. And definitely at that point, that's a point where I would recommend that treatment will occur. And then for the final group of patients, leg cramps at night or restless legs do have an association with varicose veins. And if you suffer from those, then it's definitely worth getting a venous assessment. If I see significant venous disease, I quite often will then recommend a trial of compression. And that's a useful way to work out if the leg cramps or night cramps or restless legs are going to make a good response to treatment of any underlying venous disease. Anyone who has a family history of other family members who are affected with varicose veins are at risk. And when you add to that, then the situational factors like being on your feet for lengthy periods of time, people who are standing or walking a lot, that will exacerbate that risk factor. And I've already mentioned pregnancy and all of the changes that happened during particularly the later stages of pregnancy, when blood flow increases throughout the body and increased pressure in the womb from the growing baby, really can make quite significant increases in pressure in the veins of the lower limb. And that's the mechanism through which pregnancy will exacerbate varicose veins and propagate the veins that may be mildly visible. Quite often will become a lot more obvious during the later stages of pregnancy. The most important part of the assessment when you come to clinic is the ultrasound assessment. That gives me an opportunity to see where varicose veins are coming from. And that's the most important question that I need to ask myself when I'm planning treatment. And then it also informs me in how or what methods I can use to treat veins. So at the clinical assessment, well, first of all, we'll talk about veins. see which symptoms may or may not be present, and most importantly, see what the patient hopes to get out of the treatment. For some people, it's a simple cosmetic benefit. For other people, there are specific symptoms that they are suffering particularly from. And for an unfortunate few, there's already been progression to the point where skin damage and possibly ulceration has occurred. So we'll take some time to work out what the desired endpoint of treatment is. I'll assess the veins just first of all by looking to see where they are, what types they are, what's happening in the skin more around the ankles. And then the last part is that detailed ultrasound assessment. I quite often look at the deep veins to make sure they're healthy. Then assess the superficial veins very carefully to look for hidden sites of reflux that maybe hadn't been picked up before, maybe isn't completely obvious from just a clinical assessment. And then look at the nature of the main veins that require treatment, where they lie, what size they are, and what the best treatment options are. And then that then informs the discussion about how we're going to progress and what procedures are likely to make the best impact on the complaints and concerns that the patient initially had. Well, I do all my treatments by keyhole means. So the days of surgery are long gone, and it's almost 10 years now since I last did an operation for varicose veins. The first line of treatment for the majority of my patients is laser ablation. And laser ablation works not on the veins that you can see, but on the veins that are the underlying cause of the problem, the roots of the veins. It's the most effective way. It's a simple procedure. It takes about 25 minutes to do, and that replaces the old-fashioned stripping of the varicose vein, or of veins that people have maybe known from the olden days of surgery. Laser ablation takes about 20 minutes, 25 minutes for a vein. It's performed under local anaesthetic, so you do not need to be admitted to hospital. You can walk into an outpatient room, have the procedure done while you're wearing your own clothes, and walk out afterwards. Doing that laser procedure will bring about a significant improvement in symptoms of veins. And the varicose veins that you can see will actually, over a period of time, regress and become a lot less obvious, but they'll still be there. So the majority of my patients also want to have their varicose veins treated as well. And I treat those with injections with foam sclerotherapy. That works in a similar way to the laser, but it's safe to use on veins that are close to the skin. It's easy to perform on veins that are quite twisty and bendy, as varicose veins often are, that you wouldn't be able to pass a laser fiber through. And the injections, after they're performed, will kill the veins off. And over a few months, the majority of the veins will slowly turn into scar tissue and disappear completely. Well, unfortunately, as we've already discussed, varicose veins are a genetic issue, and some people just are unfortunate that they're born with a tendency to develop them. If you're one of those people, the only preventative measure that's been proven to work is the use of compression hosiery, wearing support stockings, and with that, I mean proper medical grade support. Then that will slow down the progression of venous disease. However, it will still progress. Compression hosiery isn't particularly pleasant to wear, particularly in the warmer months. So what you see is that while compliance is quite good in the colder weather, once we get into the springtime, then people stop wearing them so frequently. So my message to people would be, if you are concerned about the possibility of venous disease, or you've got some varicose veins and you think they've been getting worse, is at least just come and get an assessment. I can look with an ultrasound at the underlying veins that might be driving the process, and then give some tailored advice as to how desirable it would be to have something done, whether that needs to be done sooner, or is it something that you can think about doing maybe a few years or further down the line, and finally give some proper advice on good quality, well-fitting compression stockings that will be much more pleasant to wear than the sort of things that you can buy off the shelf or maybe get on prescription from your doctor.